So today we are going to be doing some directional term work, and we're going to talk about a few of them, and then through this video you'll be answering a few questions using the directional terms. So remember, these are going to be used to tell the position of one thing in relation to another thing. So we have directional terms like anterior and posterior, and those are going to mean either in front of or in back of. So this grouping, just like the other groupings, the two words mean the opposite of each other. Okay, so posterior and anterior, they mean the opposite of each other. So anterior is going to be towards the front. So if something is anterior to something else, that means that it is in front of that thing. If there is something that is posterior, then that means that it is behind the other thing that you're talking about. Okay, so for example, you could have, so using the skeleton as our example, okay, we have the sternum here, and then we have the vertebrae back here. So, remember, we're talking about these in relation to the patients, okay? Or you can be talking about yourself too. So we would say that the sternum right here is anterior, so it is in front of the vertebrae, and the vertebrae are posterior because they're behind. So the vertebrae are posterior to the sternum, okay? So that's the first example. Next, we'll do medial and lateral. Okay, so medial is going to be as close to the midline or closer to the midline than the other thing. Okay, so the midline is straight down the middle of the body, divides into perfect left and right halves. Okay, so if something is medial to something else, then that means that it is going to be closer to the midline. Okay, so for example, we'll use the sternum again as our example. The sternum is medial to, we'll say, the shoulder joints. Okay, so the shoulder joint is out to the side, so it is farther away from the midline than the sternum. So the sternum is medial to the shoulder joint. So the opposite of that is lateral. Okay, so for those of you that play football, or I think soccer uses this term too, but lateral means that it is to the side, so it's farther away from that midline. So that would mean that our shoulder joint is lateral to the sternum, okay? So again, those two are opposite of each other. Next, we have superior and inferior. So these are pretty easy. So superior means above. Okay, so with the body in anatomical position like this, superior means above. So the head is superior to the chest. Okay, and that is in opposition to the inferior term. Okay, so if something is inferior, that means that it is below. Okay, so the chest would be inferior to the head. Okay, so trying to think of the other ones right now. We have superficial and deep. So if something is superficial, then that means it is closer to the body's surface, right? So it's a little difficult to do that with the skeleton, right? But you can think of it like this. Your skull, or even the skin outside of your skull, is superficial to your brain. Okay, so those things are closer to the surface. Obviously, your skin is going to be the most superficial part of you because it covers you. But the brain is farther away from the outside, so that means that it is deep. Okay, so it's superficial for closer to the body's surface, okay, like your skin. Deep if it is farther away. So, you would go skin, muscle, bone. Okay, and then even like in your head, you go even farther and you would get to your brain, okay? And the last one that we have is proximal and distal. So in these, we're using the limb as the example. So if something is proximal, that means that it is closer to the body's core, okay, to the torso, which is like the chest and the abdomen. So if it is proximal, that means it is closer. If it's distal, that means it is farther away. All right, so for example, we can use the elbow and the wrist. So the elbow, that's closer to the trunk. So the elbow is proximal to the wrist, right? And since the wrist is farther away, the wrist is distal to the elbow, okay? Because it's farther away from the body's core. All right, so at this point, I am going to get you into some questions. So we're gonna do 10 just as a review. Okay, so I'm gonna use the skeleton here mainly for these purposes. All right, so the first one that we are going to do, and I've used this example before, right, but at least with a face. So we're gonna use, okay, the nose right here. The nose is blank to the mouth. All right, so think about that. Which of those directional terms applies here? The nose right here is blank to the mouth. Now the second one that we will do involve the ribs. Okay, so the ribs here, okay, or your ribs are blank to your lungs. Right? Which directional term applies here? Right? But think about that. Where are the lungs in relation to the ribs? Okay, the ribs are blank to the lungs. All right, third, we are going to do the hip. Okay, so the hip bones, these are blank to the ribs. All right, so look at the location of these. The hip bones are blank to the ribs. That is the third question. All right, about the fourth question, we will do the humerus. Okay, so that is your upper arm bone. Your humerus is blank to your ulna, okay, which is one of your forearm bones. So your humerus, which is up here, is blank to your ulna, which is the bone right here. So the humerus is blank to the ulna. That is number 4. All right, number 5. So I think for this one, we will do, okay, think your heart. Okay, so your heart is within your chest. Your heart is blank to your vertebrae. Okay, so you should be able to feel your vertebrae right here. Your heart is inside your chest. So your heart is blank to your vertebrae. That is number 5. Okay, number 6. Of course, that leg doesn't bend. So we're gonna use this leg. And we're gonna say, so the patella, the kneecap right here, the patella is blank to the femur. Okay, so that is your thigh bone. The patella, which is right here in your kneecap, that is blank to the femur. All right, that's number 6. Number 7. So we're going to go with your chest here. Okay, so your chest, we'll say the mammary region, okay, that is blank to your acromial region. So mammary, acromial. So your mammary region is blank to your acromial region. That is number 7. All right, number 8. So down here in your, making up your pelvis, okay, is your sacrum. Okay, so that's the end of your vertebral column. Okay, so your sacrum right here is blank to your vertebrae up here, right? Which directional term applies here? So the sacrum is blank to the vertebrae. All right. So 2 more I gotta think of. So how about let's do, so think of the chicken wing now, and think of where you found everything, and it's the same way with the human body. So we're gonna say the muscles are blank to the skin. So what directional term applies there? The muscles are blank to the skin. Okay, and then finally, oh man, I don't know which one to do. How about the, so we'll use your teeth, okay? So your teeth are blank to your tongue, all right? We'll do the front teeth, okay? Your front teeth are blank to your tongue, okay, in anatomical position. So that is number 10. Your teeth, your front teeth are blank to your tongue. That should be a little clue there, right? So make sure that you have all 10 of these questions answered. You won't have been able to get through the video if you hadn't, and you'll get credit for today.